Thank you for joining us. Thank you to former Congressman Tom Perriello and our speakers here for joining us today. My name is Katie Baker. I am the Virginia State Director of Protect Our Care. We are a national advocacy organization whose mission is to strengthen and protect healthcare, and we do so largely through events like this one. And we're here today because it's a very timely thing in the news that's happening right now. 2 weeks from now, Virginia's open enrollment deadline for people who buy their health insurance on the Virginia marketplace is going to come right up on us. And Congress has still not struck a deal, and candidly, it's looking like it's not something that's going to happen at all, to extend these enhanced premium tax credits that have made health insurance more affordable for over 300,000 people in Virginia this past year. And in terms of the people who are impacted, small business owners. About 80% of small business owners purchase their health insurance on the Virginia marketplace, as well as self-employed people, people who are part-time workers who don't have quite enough hours to qualify for health insurance, people who are employees of small businesses. Small businesses that have less than 50 employees don't have to provide health insurance, and it can often be very difficult for them to because it's so hard to scale at that level. But those Affordable Care Act tax credits have made it possible for a lot of employees of small businesses to be able to obtain access to affordable health care and very good high-quality plans through that marketplace. But what's going to happen now, and they've already expired. They expired at the end of December 2025. People have already got their premiums. Your increases in the mail, you're going to hear from somebody today who's already seen her premiums go up. And about 100,000 people who buy their health insurance on the marketplace, that's about 1 out of every 4 people in Virginia who buy their health insurance on the marketplace, are projected to just drop their plans. And in fact, NBC News is reporting that Virginia state health officials have already said that roughly twice as many people have already decided to end their coverage. So we don't have final numbers just yet, but this is very serious. And what's going to happen to all those people? About half of them are going to find health insurance somewhere else. Some of them are lucky enough to have partners where they can maybe get on their plans even though they're paying more. And about half of them are just going to drop their plans entirely, which is going to increase costs on the entire system. And with that, I think that's a good segue to introduce our next speaker who can talk about the strain on the system that this is going to place, and that is Dr. Peggy Plouzogin. Doctor.
Thank you. Good morning, and thanks for being here. I am a general internist, and I have practiced primary care and hospital medicine in Charlottesville for 25 years, in Virginia for almost 30 years. I love this place, and I love the people I served as a doctor over all these years, and I have absolutely no doubt that if these tax credits are taken away, the people of Charlottesville and our region will suffer. I know that because I know what it was like for my patients before the ACA tax credits. The people we're talking about, as Katie said, are middle and low income working people who don't happen to work at a job that provides health insurance. They run small businesses, they're chefs and restaurant owners, they run the nonprofits that support so many of our community. Prior to the ACA, these folks could not afford health insurance, so they went without. What does that look like? Well, they didn't get their screening colonoscopy, their pap tests, or their mammograms. They couldn't afford their medication, so they either didn't take it or they took it every other day to make it last. As you can imagine, that doesn't go well. Almost inevitably, particularly in my over 50 folks, something happened that landed them in the emergency room or in the hospital. And if they did well medically, they had a hospital bill that was often catastrophic. Some of them lost their cars or their homes. What people don't realize is that almost any trip to the emergency room or the hospital costs more than most moderate income people can pay out of pocket. The other thing people don't realize is that when we take away options on the front end, we all pay for it, quite literally, at the back end. The people who have no insurance pay for it with their health, sometimes with their lives. That's not an exaggeration. The medical system has to try to save people at a later, much more complicated stage in their disease. Charlottesville pays for it by some of these small business owners being unable to stay afloat. Virginia pays for it by having to manage the rising number of uninsured patients, still, of course, who need care, resulting in higher costs to the hospitals and to the state. In fact, like some patients, if we take away these tax credits, some hospitals may not survive this completely preventable situation. I want to try and make it real for you, the kinds of decisions that people in Virginia are facing right now, and what hangs in the balance as the Senate contemplates whether to vote to extend or to take away these tax credits for working Americans. And frankly, I want to ask John McGuire and any other legislator who voted to take these away, what would you have these people do? What would you say to the Charlottesville businessman who has cancer and is in the middle of his treatments when his health insurance premiums rise overnight because of your vote to a level that he cannot pay? Should he drop his insurance and forgo his chemo? Should he sell his house? Should he start a GoFundMe page? And what about the Charlottesville chef who is in her third trimester of a high-risk pregnancy? Should she try to have a home birth? It's cheaper. This is real, John McGuire. These people are in their doctor's offices right now trying to figure out what to do. Of course, in both of these cases, eventually there evolves a situation that requires urgent medical intervention. Thus, the crushing medical debt will likely occur even if these people try their best to avoid it. And what about the young Albemarle County family of 4 who are not yet facing any medical issues? When their premiums rise, and they can no longer continue with their insurance, should they then forgo those immunizations or the mammogram or the pap smear? How can they avoid the emergency room when their son Jason takes a hit in football practice that knocks him unconscious? Coach says he has to go to the ER, but they can't afford it. When people can purchase health insurance for themselves and for their children, they have agency and dignity and choice. They can be proactive with their own care and that of their children. We're here today because many of them, hundreds of thousands of them in Virginia, may lose that agency and dignity and choice. And when they lose, we all lose.
Thank you so much, Doctor. You said a couple things that got my brain turning of a few other things I wanted to build on. And one, as you mentioned, it's not just the people who are losing those tax credits who are going to be impacted. Even for folks who don't qualify for the tax credits, who buy their health insurance on their marketplace, the health insurance companies have already jacked up prices by 20%. And that's even before the tax credits are factored in, because they're anticipating that all those people are going to drop off. So when people lose their health insurance, everyone else is going to pay more. And even for folks who don't buy their health insurance on the marketplace, health insurance companies are still jacking up premiums to account for just the increased and uncompensated care. So for example, I buy a plan that happens to not be on the marketplace. I got my renewal notice and I'm paying more than $100 a month extra now. So this is going to impact everybody, and if you see your health insurance premiums going up, it's because of these massive cuts that we've seen in healthcare to the Affordable Care Act and to Medicaid last year when Congress passed the, as we call it, the big ugly law. And Doctor, you said something else I wanted to further expand on. There was just a vote last week, for those who are following, in the U.S. House of Representatives, where 17 House Republicans joined Democrats in voting to extend what they call a clean 3-year extension of these Affordable Care Act tax credits. And I don't like to give him too much credit because he voted to cut Medicaid, but my own Congressman Rob Whitman next door in the first actually did join Democrats in voting to extend those tax credits, and yet John McGuire here in this district did not. And so we really need to put the pressure on him and hold him accountable for that. And next, it's my honor to introduce a local small business owner here from Albemarle County, Elizabeth Beasley. Elizabeth.
Thank you. Dr. Bluzogan, your talk gave me chills. So as Katie shared, my name is Elizabeth Beasley. I'm a resident of Albemarle County. I am a small business owner. My husband is a small business owner, and together we have 4 amazing little girls. When I considered copycatting Bubba, his name is Bubba, that's my husband, and starting my own business, the biggest risk was not getting the work. It was whether we could afford health insurance for our family, our big family. Before we were able to access coverage through the Affordable Care Act, we were paying about $1,400 a month for a health insurance plan that offered less coverage than what we have now. When we qualified for coverage through the Affordable Care Act, that cost dropped to about $700 a month. Today, that same plan costs us around $1,600 a month. That kind of swing, hundreds of dollars a month, thousands of dollars a year, year after year, is kind of staggering. And it's not unique to our family. It is the reality that many working families are navigating today. Before the Affordable Care tax credits, our family was on a plan that looked affordable on paper. In reality, it was not. The premiums were high, the coverage was limited, and when our kids got sick, and they're sick a lot, we ended up carrying real medical debt. What we thought would be a routine procedure for one of my girls ended up costing us more than $5,000 out of pocket. And that's just one example. We were working really hard, doing what we're supposed to do, and still struggling just to afford basic care. The Affordable Care Act paired with the tax credits changed that. For the first time as small business owners, we had coverage that actually worked for my family. It allowed us to see doctors when we needed to, manage our care responsibly, and plan our lives without the constant fear that one illness could upend everything. Those tax credits also made it possible for me to sustain my small business. Running our own businesses gives my family flexibility. But that flexibility only works if health insurance is stable and affordable. At the same time, my 2 youngest girls are twins. Anyone who has paid for childcare can imagine what it means to cover those costs for 2 children at once. And there was a year, 2024, we were paying childcare for 3 of our girls. We made those choices intentionally because staying in the workforce and continuing to work mattered to my family's stability and our future. Those decisions only work when systems like affordable health insurance function as intended. This year marked a real milestone for us. My youngest 2 started kindergarten. For the first time in almost a decade, we were not paying much of our income in childcare. This was the year Bubba and I started to imagine that planning for our future felt possible. If the tax credits are not renewed, which we know they're not currently, we're gonna adapt. We're gonna hustle a lot harder, and the cost of that hustle will be the most important thing that we have, our time together as a family. Part of why I'm speaking today is because I know that my family can and will adapt, while many others cannot. The same increase that slows us down could push someone else out of coverage entirely. We will continue to access health insurance through the Affordable Care Act, even if it comes at more than double the cost. Paying that price is going to set us back significantly. This issue is about whether working families and small business owners like me can build a future with stability and confidence. For families like mine, the Affordable Care tax credits provide stability. Losing them has real and lasting consequences. I really appreciate the opportunity to share our story. I'm going to turn it back to Katie.
Thank you so much for sharing that story, Elizabeth. And, as she alluded to, she's one of 35,000 people in the 5th District who this past year have been able to purchase their health insurance through the Affordable Care Act marketplace. So we're talking about tens of thousands of people in this district alone who are making very tough decisions and who come from all walks of life. And, I know we've been talking specifically about the news of the day, which is these tax credits and the fight on Capitol Hill and this open enrollment deadline coming up. But I want to take a moment just to take a step back and talk about the Affordable Care Act a little bit more broadly. And I realized as I was driving here I live in Henrico, I've had the great privilege of having a front seat to two really historic moments in our nation's history and in our state's history when it comes to extending affordable health care to what's today about 1 million people in this state. And the first was when the Affordable Care Act passed back in 2010. I was just starting my career. I was still in my 20s, so you can do the math. And I was an intern on Capitol Hill for a member of Congress from my home state of Ohio. And I was there that winter, right before the Affordable Care Act, it passed in March. And for about 8 or 9 weeks, my whole job was answering the phone about 8 hours a day for my member of Congress. And I had people from all over the country who were yelling and screaming and swearing, "You need to tell your congresswoman to vote no." And it was a very difficult time, but I knew that I was part of something greater. And I didn't know him yet, but Tom was in Congress at the time. And he must have been experiencing what I was experiencing at this micro level 100 times that, because I know you did hundreds of hours of town halls all through the 5th District. And I think you had people who were very upset because of the fear of the unknown with the Affordable Care Act passing. But because of that profile and courage and that vote, millions of people have since been able to access health care. And young people can stay on their parents' plans until they're 26 years old. Insurance companies can no longer discriminate against pre-existing conditions. People can get no-cost preventative care. And there was another provision of the Affordable Care Act that allowed states to expand Medicaid to lower-income working adults. And because of the leadership of people like former House Democratic leader and former Mayor David Toscano in the General Assembly, and he wanted to be here today. He texted me this morning. He was so sorry, but he was sick. Virginia was able to expand Medicaid. And I was working for David at the time, and it really was surreal to know that because of our work, numbers fluctuated over the years, but I think it's around 600,000 people today have their health insurance through Medicaid. And that's on top of the about 400,000 people here in Virginia who are getting their, through Medicaid expansion rather, about the 400,000 who are buying their health insurance through the Affordable Care Act. So that's really what's at stake, and just Protect Our Care is so grateful for your vote. And with that, I'm so honored to introduce former Congressman Tom Perriello.
Thank you, Katie, and really thank you all for your stories. I just want to be very clear about who's paying the price for what John McGuire and Congress have done. Their recent actions are a gut punch to the middle class and to small business owners. They have already kicked the working poor while they're down. But this particular action is primarily raising costs for the middle class that's getting squeezed in every direction and small business owners who are trying to do the right thing for their employers. When we did the Affordable Care Act, the two of the groups we were most interested in trying to help were the middle class that were getting squeezed and small business owners who didn't have the same purchasing power as big corporations to try to provide care for their employees. And what we know is our local small business owners like Elizabeth are the ones that are most likely to take good care of their workers. They're most likely to want to provide that care. And I want to be clear that one of the outcomes of John McGuire raising premium costs for the middle class and for small business is that people will not get a raise in their paycheck this year. We have a lot of local employers who've been wanting to give their workers a raise. And for the past few years, the reason they can't do that is that extra money is going into premium costs going up and up because John McGuire and other Republicans have sat there and said, we're okay sticking it to the middle class and small business owners. And why? So they could give Elon Musk a $300,000 tax credit that he does not need instead of a few $1,000s for middle-class families in Charlottesville and Central Virginia that could transform their lives. And I want to come back to something Elizabeth said because she spoke not just as a small business owner, but as a mother. And in addition to what John McGuire and this Congress are taking out of the pockets of the middle class, they're also taking something that you cannot put a price tag on, which is time with your kids. People are working a second job in order to pay for healthcare costs instead of getting that time with their families. We talk about small business owners who are having to put in those extra hours. That's time they'll never get back with their daughters. And that's something that I just don't understand, how a politician elected to represent a group of people would then go to Washington and kick those people to the curb so that they can give another tax credit to Elon Musk and Peter Thiel. And these have huge impacts, not just in Charlottesville and Albemarle, but as I go around the 5th District, we have rural clinics that have been able to stay open only because of the kind of Medicaid expansion and Medicare that John McGuire's voted against both in Richmond and now in Washington. We have people who are going to have to go over an hour for care if these clinics close. I've been in 2 communities just in the last week that have lost their last OBGYN because we don't have the reimbursement rates we need and the levels of coverage we need to be able to keep doctors in some of our rural communities. I am not saying that every politician has to take on the whole healthcare system and try to fix it like some of us tried to do when we were in office. But from time to time, there is nowhere to hide. And this vote was a clean up or down vote. Do you want the middle class to pay more for health care or less for health care? And John McGuire said, I'm okay with the middle class paying more for health care. It was a straight up or down vote. Do you want to help small business owners be able to afford health care coverage, or do you want to stick it to small business owners? And he said, I'm okay sticking it to small business owners. We need the Senate to move on a bipartisan basis immediately to bring these premiums down. We need to build on the success of the ACA to do even more healthcare reform that, again, understands just how much our middle class and small business owners are being hit. But on this vote, there was nowhere to hide. It showed us both the character and the priorities of John McGuire and politicians across this country who were willing to throw the middle class and small business owners under the bus. I can tell you that one of the reasons I've never regretted my vote for the Affordable Care Act is every day in the grocery store, at a house of worship, people are coming up to me and telling the stories of how the ACA helped transform their lives. I'm on the exchange. I have health care on the exchange for the 4th time in my life because part of what we recognized is we no longer live in an economy where most people go get a job out of high school or college and stay with a single employer for the next 40 years. That's not the economy we live in. We wanted to have these exchanges so when people like me and small business owners want to start a small business, want to be self-employed, go through a period of unemployment or underemployment, there's always a place to get affordable care. That is part of the system that we help to fix. And if politicians like John McGuire keep favoring billionaires over the middle class and small business owners, you will continue to choke out that system. First, voting against the hardworking poor from getting care, then the middle class, then small business owners. And what's left is a system that can no longer afford to provide the services that we all buy the insurance for in the first place. So I just really appreciate doctors who've been speaking up to speak to just what this means for our healthcare system, hearing from parents and small business owners being very real about how this vote is hurting the middle class and small business owners. And there is still time, if Republicans are willing to do it, to move this in the Senate. But so far, unfortunately, we've seen the wrong priorities in Washington, and we've seen a lack of courage, and that has direct costs, not just for Charlottesville and Albemarle, but also for our rural communities across Central and Southside Virginia. So appreciate people standing up, appreciate Katie speaking out, and thank you for being here today.
Well, thank you so much. I'm happy to take questions on the topic at hand from the podium. Otherwise, we're happy to do one-on-ones or a scrum with the former congressman. And our yes, and our speakers as well are happy to do stand-ups.
Talk about credibility.
I have a question that's kind of slightly related. Why have insurance companies privately never thought about, or maybe they do, offer small businesses and stuff like a consortium where they can buy healthcare? It seems like they don't often.
So I'll start. I mean, essentially that's what the exchange is supposed to be. It was supposed to be able to scale purchasers, right? So if you're an employer who has 1,500 employees, then you could negotiate in the old days directly with the health insurance companies, and you presented a big enough pool that they would probably want to give you a good rate. But if you were a small business owner with only 3 employees, then you would get stuck with a much higher bill. And that was even more true if you happened to have one employee or family member of an employee who had some sort of a pre-existing condition. So the exchange was meant to bring people together to have the same purchasing power that a multinational corporation has. That's why when McGuire voted against the exchange or voted against expanding the Medicaid efforts in the exchange, each of those things is part of what makes sure more people in the system are being paid for and fewer of the insurance costs, say from the emergency room, get passed on. Now, we all know who ends up getting the bill for those sunk costs, and it's the middle class. They move it on to the employer who only has a couple of employees, to the self-employed person and the middle class person. And that's why the ACA was meant to increase that negotiating position. And that's why I can get affordable options on the exchange when I go through periods of starting an LLC or other things. What we would want to do is actually increase that negotiating power of the middle class and small business owners more by making those exchanges stronger, but that was the original idea. I don't know if you guys want to add anything.
Okay, so I think if reporters want to do stand-ups with any of our speakers, I'd be happy to help facilitate that. But thank you all for coming. This has been a great event.